Have you ever felt like you just had so much appetite and kept eating a lot, but you just couldn't gain any weight and kept losing it instead? Or maybe you've noticed a rapid, irregular heart rate that feels like your heart is racing. Those could be symptoms of hyperthyroidism, and that's what we're going to talk about today. Welcome back to RN Info, the place where you get clear, reliable information on health topics. Today, we're diving into hyperthyroidism. Stay tuned to the end for some questions to see how much you've retained. So, what is hyperthyroidism? Hyperthyroidism, also known as an overactive thyroid, is a condition where the thyroid gland produces and releases high levels of thyroid hormones. These include T3 or triiodothyronine and T4 or thyroxine. Hyperthyroidism speeds up your metabolism and can affect different aspects of your health. Now, let's look at the symptoms. Common symptoms include a rapid, irregular heart rate, increased blood pressure, shakiness, tremors, anxiety, and nervousness. You might also notice unexplained weight loss despite an increased appetite, excessive sweating, changes to the menstrual cycle, and insomnia, which is difficulty sleeping. Other symptoms include goiter, which is a swelling or enlargement in the neck, and there's also bulging of the eyes. These symptoms can start gradually or come on suddenly. Okay, let's look at the possible causes. Several medical conditions can cause hyperthyroidism. One is Graves' disease. This is an autoimmune condition where the immune system attacks the thyroid, causing it to release excess hormones. The risk is higher if there's a family history of thyroid disease. Second are thyroid nodules, which are lumps or areas of cell growth in the thyroid gland that can produce excess hormones. These are rarely cancerous. Third is thyroiditis, an inflammation of the thyroid gland that may cause temporary hyperthyroidism. Less common causes include consuming excess iodine, since iodine is one of the essential factors in creating these hormones, and a TSH releasing pituitary adenoma. As for risk factors, these include family history of thyroid disease, especially Graves' disease, smoking, and pregnancy, which increases the risk of thyroiditis. Now, let's look at the possible complications can occur from hyperthyroidism. It can lead to heart problems such as irregular heart rhythms, like atrial fibrillation, which then increases the risk of a stroke, as well as congestive heart failure. It can cause brittle bones and vision problems. One serious complication is thyroid storm. This is a medical emergency with life-threatening symptoms that includes fever, rapid heart rate, nausea and vomiting, diarrhea, dehydration, and confusion. This requires immediate treatment. For diagnosis, doctors typically start with a physical exam to check for signs like an enlarged thyroid or rapid heart rate, along with a thyroid blood test to measure hormone levels. T3 and T4 are usually above normal, while TSH is usually lower than normal. Imaging tests such as radioactive iodine uptake tests or an ultrasound may also be used to get a closer look at the thyroid. For treatment, options include anti-thyroid medications such as methimazole and propylthyroxine, which prevent the thyroid from producing excess hormones. Symptoms usually improve within several weeks to months. Another treatment option is radioactive iodine therapy, which specifically targets and destroys thyroid cells, often permanently. While these might cure hyperthyroidism, it can lead to hypothyroidism, which is an underactive thyroid. Most people who undergo this therapy require lifelong thyroid hormone medication such as levothyroxine to maintain normal hormone levels. Surgery is another option which involves the removal of all or part of the thyroid. This also requires lifelong hormone ter- medication. Beta blockers may be added to help to manage symptoms like rapid heart rate, shakiness, and nervousness. Okay, we've come to the end of the main content. Let's dive into some questions. First question: in a typical diagnosis of hyperthyroidism, which pattern of thyroid hormones is most commonly observed in blood tests? The answer is high T3 and T4 levels with low TSH levels. Second question: which autoimmune condition is identified as a primary cause of hyperthyroidism, where the immune system mistakenly attacks the thyroid gland? The answer is Graves' disease. And lastly, which of the following is a life-threatening complication of hyperthyroidism characterized by fever, confusion, and a rapid heart rate? The answer is thyroid storm. Okay, that brings us to the end of the video. If you found this helpful, please like and subscribe, and I'll see you in the next one.